Loneliness. It's a word that resonates with many, yet it often goes unspoken. Recent studies reveal that at least 1 in 2 adults in the United States is grappling with considerable levels of loneliness. This is not just a fleeting feeling, it's a profound emotional state that can have significant repercussions on our physical, mental, and societal health. Loneliness can be likened to hunger or thirst, a signal that something essential for our survival is missing. When we experience it, our instinct is to seek connection. However, when that feeling persists, it becomes a cause for concern. Loneliness is a subjective experience, defined by the gap between the connections we desire and those we actually have. While many of us may feel lonely at times, the statistics are alarming. 1 in 2 adults in America report measurable levels of loneliness, with even higher rates among young people. The factors contributing to this epidemic are multifaceted. In our modern society, we gather less frequently for dinners with friends or neighbors. Our time is increasingly consumed by social media and online interactions, which, while beneficial in some respects, often detract from the in-person connections that once defined our social lives. Technology has made life more convenient, but it has also led to a decrease in spontaneous encounters, those brief moments of connection we used to have in grocery stores, retail shops, or simply in our neighborhoods. This growing isolation has been exacerbated by the COVID-19 pandemic, leaving lingering effects that continue to impact our lives. For nearly half a century, we have witnessed a decline in participation in organizations that once brought us together, recreational leagues, service groups, and faith-based communities. The consequences of this social disconnection are dire. Research indicates that prolonged loneliness can lead to increased risks of anxiety, depression, heart disease, dementia, and even premature death. The mortality impact of loneliness is staggering, comparable to smoking daily and even surpassing the risks associated with obesity. Yet, there is hope. Investing in social connections can enhance our well-being both in the short term and long term. Simple acts, such as calling a friend to check in or responding to a call with genuine interest, can significantly alter our emotional landscape. The most effective way to connect remains face-to-face interaction. However, if that's not possible, a phone call or video chat can still bridge the gap. Even a few minutes spent in person can be more impactful than a lengthy, distracted conversation over text. So, how can we combat loneliness in our lives? It doesn't require monumental changes. Start small. Dedicate just 15 minutes a day to reach out to someone you care about, be it an old friend, a family member, or a colleague. These small gestures can create ripples of connection, fostering a sense of belonging. In a world that often feels disconnected, let us remember the power of human connection. Together, we can combat loneliness and build a healthier, more connected society.